My name is Bat-Sheva Maslow. I'm a reproductive endocrinologist. I work at Extend Fertility. In my practice, I see a lot of women who are interested in egg freezing. I counsel lots of women about their reproductive choices and how time influences those. And so maybe 80% of what I see is women who are interested in freezing their eggs, and about 20% of what I see are women or couples who are interested in getting pregnant, more traditional infertility. Now we're in this sort of very uncertain, unprecedented time where all fertility treatments are on hold. People are rethinking all sorts of aspects of their lives. And this is an opportunity to really take the chance to talk freely about some of these issues related to fertility and fertility preservation. What are some of the things you need to know when you're thinking about egg freezing? Egg freezing is something that women often consider when there's going to be a pause on their ability to conceive. And when we talk in my office about the goals and the role of egg freezing, we often discuss, what is the impact that time and age has on fertility. And we know that time has a very significant impact on female fertility, but we measure that time in years, not in months. In my practice, it is very common that women will come to my office, we'll have our consultation, we'll talk about egg freezing, and they come back to see me 3 months, 6 months later, and not much has changed. And ultimately, they end up doing just as well as we would expect from the beginning, even though they had to delay for a few months. If egg freezing was something you were considering and now you have to put it on hold because of what's going on, you are not really sacrificing a lot. Even before this global pandemic, even before all these fertility treatments were put on hold, often I counseled my patients about taking the time that they need to make sure that this was the right thing for them. I don't want you to feel like the fact that you have to delay is something that's going to have a major impact on your treatment. So there's a few sort of emotional, mental things that we can do to prepare, and then there's a few physical things that we can do to prepare. So the first is to really think constructively about your reproductive goals. Often by the time women get to my office who are coming for consultation, they've really thought long and hard about what it is they want from their future families. Do they want a family? How big do they want that family to be? When do they think they would want to try to conceive? Or when do they think they're going to be able to try to conceive? Having a real heart-to-heart with yourself about those goals can really help you focus on whether or not this is a process that's going to be useful for you, going to be valuable for you. There are women who come to see me because they're not sure they want to have children at all, but they don't want to be in a circumstance where that choice got taken away from them. And those conversations are very different than the woman who desperately wants a really large family but hasn't found a partner yet. The more constructively you can think about your reproductive goals in advance, the more prepared you're going to be to make decisions about this process. The second is financial planning. Now, we know that egg freezing is expensive. You're going to be able to feel more prepared to go forward with this process if you know that you've really thought about the finances and thought about how you're going to be able to save money for it if that's what you need to do, so that it doesn't catch you by surprise once we're ready to go. The third is phone consultations. We are currently doing all our consultations digitally, either by phone or video. And what that allows you to do, especially for women who are considering egg freezing, is to really talk through a lot of these issues so that in a month or two, when we're really ready to get going, you've really gotten the opportunity to sort through some of these issues and really laser focus your attention on the things that really matter to you personally. Even if you're just considering it or you want more information, now is the opportunity. It's an opportunity to really get as educated as possible about female fertility, what happens to female fertility as we get older, and how can we use that information to make the best decisions for our lives. Now is the time to really learn that. The last piece in terms of the sort of mental, emotional preparedness is home AMH testing. So AMH stands for anti-Mullerian hormone. Anti-Mullerian hormone is a hormone that's produced by the eggs themselves. It's our best tool to estimate an egg supply. Now, women are born with all the eggs we'll ever have. Eventually, we run out when we go into menopause. But every woman is different. Everyone's born with a different number of eggs. We all lose our eggs at different speeds. And so the amount of eggs that any one person has at any given age is highly variable from person to person. AMH is an imperfect test. It is not as precise as we would ever hope it could be, but is the best tool we have to help estimate how many eggs somebody's going to be able to make in their egg freezing process. There is a company that allows women to have at-home fertility testing. They do at-home AMH testing, but it's not available in all states. For those of you who live outside New York, New Jersey, and Rhode Island who might be interested in at-home testing, the company's name is Modern Fertility. This is the perfect opportunity to take the time to do the test at home since you can't go out anyways. And then a consultation with a physician allows you to interpret that test and make sense of it for you. And in the context of your life and in the context of your reproductive goals and what you can do. There are some things that we can do that are more physical, the real physical actions that could help improve the outcome once we decide this is something we really are seriously considering at the end of this pandemic. So the first one, birth control pills, is really, I think, the primary thing that women who are considering egg freezing can do in this time to really help improve their outcomes. The extensive research and data that we've done and analyzed at our facility, having done now over 3,000 egg freezing cycles, we've come to recognize the impact that birth control pills can have on both the fertility assessment in terms of the measurements of egg supply, like AMH I mentioned earlier, and our ultrasound, but also on the way that women respond to the process. So that we know that women who are on birth control pills, while it doesn't affect your future fertility, it doesn't affect fertility in any way, it blunts the response to the stimulation for the egg freezing process. And so for women who are really serious about egg freezing, and they come to me and we talk about it in our consultation, I will often recommend that they go off their birth control pills for about 2 to 3 months before starting the process. That allows their body to kind of come back to baseline and get the most out of the stimulation, get the most as they can out of a single cycle. Now, I'm going to put a little pointer in there, is that if you're using the birth control pills for contraception, you obviously need to find some kind of backup method. And if pregnancy is not what your goal is right now, we don't want that to be an unwanted side effect. Smoking. For those of you who may be smokers out there, this is your chance to stop smoking. Smoking is one of the few things that we know that environmentally has an impact on egg quality and quantity. There aren't very many things, but smoking is one of them, and it can be profound. It's also a huge impact on your overall health, especially now we're in the middle of a health crisis, one that's of respiratory nature. Any respiratory damage is going to put you at risk for more complications. And so if you were looking for an opportunity, looking for an excuse to stop smoking, this is it. Exercise. Exercise in and of itself is not going to have this magical impact on your fertility and your future reproductive goals. But sticking with an exercise routine is helpful for everyone's mental health, for everyone's physical health, which means that our overall reproductive system is going to be healthier. It also means that our response to the stimulation, once we decide we want to go forward with an egg freezing cycle, is going to be better. And so for as much as you can commit to trying to keep your exercise routines up, or start one if you've never been a big exerciser in the past, that's going to be helpful. The last are two supplements that are on the market. One's called DHEA, the other is called CoQ10. They've both been marketed as sort of fertility improvement supplements. I will say, and when I talk to my patients about this, I often tell them that the data is limited and it's modest about the improvement that it could have. The studies that were done looked at women who were doing IVF to get pregnant. They were looking at women who had what's called diminished ovarian reserve, where they had a low egg supply. And there was an increase in pregnancy rates in women who had a low egg supply with IVF using these two supplements 3 times a day for 3 months. So there really is 0 studies that have looked at women who are doing egg freezing, and we really don't know if these supplements would have any impact at all on women who are thinking about freezing their eggs. But I bring it up here because if you're someone who you fit into that category, you know that you have a diminished egg supply, you kind of now have 1 to 2 to 3 months in front of you where we can't do anything really aggressive about fertility preservation, this might be something that you may want to try. The benefits are modest at best, but they're very unlikely to be harmful. So I put it out there as something that women can consider if they're really looking to do whatever they can to boost the outcome of their egg freezing cycle after this is all over. Those are sort of my buckets of suggestions. Our egg freezing consultations are complimentary. This is the opportunity to really learn about the process, learn about fertility, educate yourself so you can make decisions about your reproductive goals, being able to know the facts.